Good morning. Welcome to Dr. Wise Money. It's drwisemoney.com. It's 3 a.m. in Tucson, Arizona, the usual time that I wake up. Today I want to talk about top 5 reasons why doctors, young doctors like us, should have side gigs. Number 1, it makes us better doctors. Sir William Osler said, "The young doctor should look about early for an avocation, a pastime that will take him away from patients, pills, and potion. No one is really happy or safe without one." So, a lot of people are surprised that in medical school I had 2 jobs that takes up sometimes up to 60 hours a week. Yet at the same time, I was number 1 in my class for a little while and did quite well throughout my medical school. And then in intern year, I continued my side job as a tutor, consultant, and then picked up starting being a blogger, March of internship, and continuing into my residency in radiology. People say, well, how do you find the time? One thing, yes, I don't sleep very well, so I have a lot more hours in my life. However, even taking into account that I have maybe 20, 18 hours a day in my life that I'm not sleeping, I'm actually producing a lot more beyond the fact that I seem to have a lot of hours. So I think what it does is that when I'm blogging, it kind of keeps me grounded to kind of remind me who I am other than being a doctor. And so when I have a hobby on the side, it helps me kind of balance things a little better and come back to medicines or radiology with a more refreshed mind. And sometimes people can parallel think, you might think consulting or tutoring might not be exactly the same as being a doctor. However, explaining a concept to a student and helping them understand is quite similar to explaining that to a patient if you're in a clinical medical field. And if you're like me, a radiologist, it's real. Communication is key. It's the ultimate, most important thing with our colleagues, our ordering physicians. So those transferable skills that we developed and further in our side gigs are actually really helpful to making us more effective doctors. Number 2 reason is that I believe that having some side gigs that could potentially, usually that stems from being our hobbies, can actually make us better individuals. I realized that after I started a blog, even though it does take a lot of time, sometimes it could easily suck 30 hours a week of my time, but that's only because I still have so much room to be more efficient with it. It's not necessarily that it will require 30 hours for the rest of my life, even though I would happily give that time to blogging because I felt like it's very impactful. I feel like it's one of my way of positively helping my colleagues. And when I feel like I'm helping other doctors, I believe those doctors are better doctors to help patients. And I think in a way, it made me believe that I'm multiplying my knowledge in a very efficient way. And so through blogging, actually it gave me an additional channel to connect with other people. And knowing that that I'm helping other people actually makes me really, really happy. And if you watch the documentary Happy, it does endorse that acts of kindness. When you take up the burden, a little bit of burden of a stranger or a fellow human being, it actually makes us immensely happy. It provides the sort of happiness that's much more lasting than getting a Gucci bag. And thirdly, it gives us a little sense of control. Honestly, the career path of medicine is grueling, not just in the financial sense, in that most of us incur $400,000 of debt. Remember, the average is 180 and passed at 2015, and there are quite a bit of individuals who have no debt whatsoever because there's family help or other reason. So you have to think about the other end of the spectrum. A lot of people I know is $300,000, $400,000 in debt at 7% interest rate. So Um, and we live a very nomadic lifestyle. At every stage of training transition, we sort of are expected to just give up our current roots, our life, and up and go wherever medicine leads us. So I moved 7 times, during 7 to 8 times during pre-medical years and medical school, and I could have also had to move, after intern year, after residency, and after fellowship. So those are additional 3, 4 times of moving. So honestly, there's very little sense of control. Um, Usually, I encourage myself to just open up to change and accept things as they are rather than resist, because I realize resistance is totally non-productive. However, when we have a life that's almost like a little bag floating in the wind in terms of financially stressed and emotionally, physically drained, as well as not knowing where we will be the next year, or in the next couple months. Having a little sense of control is pretty nice. So a lot of time, if we develop our side gigs, they could be totally self-employment. It's the only time you sort of can be your own boss, at least during residency. Once you become an attending, you can do locum work, you can work for private groups and easily be your own boss that way, or have a little more sense of control. But right now, having a little side gigs provides that small sense of control to balance the great unknown that surrounds us and demands from us as medical trainees. Number 4, it also improves our time management. Just like how we grow into our income, and it's the hedonic trend, it's easy for us to spend more money on the same amount of desire, the same amount of satisfaction, or you just eat more and more expensive meals, buy more and more expensive cars. Same with time. It was interesting how when I was in medical school, I was practically single mom for the first 2 years, and I worked 2 jobs and had a 3-year-old daughter, and I studied 1 hour a day, and I did extremely well in medical school. On the contrary, I have friends who I really admire, brilliant individuals, probably much smarter than I am. They have all the time on their hands, and they have no time to cook, no time to shower, and study 16 hours a day, and unfortunately to their own detriment, they don't do as well. So I believe that when you have worthy causes in your life, things that you're passionate about, such as being a parent, such as being a doctor, such as a side gig that you think that you're giving back to the world, in addition to being a doctor, I think it actually improves our time management skills. And then lastly, as I always say, don't follow money, let money follow you. I never really anticipate that when I started tutoring a long time ago, when I was tutoring initially, it was just helping my friends. Teachers told me, hey, you were doing really well in class, why don't you help your friends? And I did. And so I was tutoring pro bono I was as young as 8 years old, 9 years old. Then gradually it just became a job, a side gig, and now I'm charging $388 an hour. Not that I'm money hungry, but it's just a simple matter of supply and demand. So those are the top 5 reasons. Makes us happier doctor, happier individuals, gives us a little sense of control, and improve our time management and increase our cash flow. Those are the 5 reasons why I believe medical trainees like myself who are in residency should take up a side gig. Well, those are just my thoughts. Comment below, and remember to visit drwisemoney.com. I love to see your questions there, because that's the best place for me to answer them, so that other people can see as well. Other readers can learn from our questions and answers. Sorry, I was clearing my throat a lot this morning. So until the next topic, take care of yourself.